Are you or someone you know facing non-small cell lung cancer with a specific genetic change? Discover Ibtrozi, a targeted therapy offering new hope for patients with ROS1 positive disease. Ibtrozi, known generically as Taletrectinib, is a prescription medicine. It is used to treat adults with non-small cell lung cancer, NSCLC. This cancer must have spread within the chest or to other body parts. Crucially, Ibtrozi is for NSCLC caused by an abnormal ROS1 gene. Your doctor will confirm this through genetic testing. This test is essential to determine if Ibtrozi is the right treatment for you. Ibtrozi belongs to a class of drugs called kinase inhibitors. It works by blocking specific proteins, ROS1 and TRK. These proteins can become overactive due to genetic changes like fusions or mutations. When ROS1 or TRK proteins are overactive, they signal cancer cells to grow and multiply uncontrollably. By inhibiting these proteins, Ibtrozi helps to stop or slow tumor growth. This targeted approach focuses on the specific driver of the cancer. Ibtrozi received approval from the FDA on June 11, 2025. It is a new medication, and currently, there is no generic version available. Its approval was based on promising results from the TRUST clinical trials. These trials demonstrated Ibtrozi's effectiveness. They showed high response rates in patients. The trials also highlighted Ibtrozi's ability to penetrate the brain, which is important for treating brain metastases. Ibtrozi is taken by mouth as a capsule. The standard dose is 600 mg once daily. It is crucial to take Ibtrozi exactly as your healthcare provider instructs. Take Ibtrozi on an empty stomach. This means you should not eat any food for at least 2 hours before taking the dose. You also should not eat for at least 2 hours after taking the dose. Try to take your dose at about the same time each day. This helps maintain consistent levels of the medication in your body. Consistency is key for optimal treatment effect. Swallow the Ibtrozi capsules whole. Do not open, crush, chew, or dissolve the capsules. Taking them whole ensures the medication is released correctly in your body. If you take an antacid, there are specific timing rules. Take the antacid at least 2 hours before or 2 hours after taking your Ibtrozi dose. Avoid proton pump inhibitors, PPIs, or H2 blocker medicines while on Ibtrozi. Like all medications, Ibtrozi can cause side effects. It's important to be aware of these and discuss them with your healthcare provider. They can help manage side effects or adjust your treatment if needed. The most common side effects reported with Ibtrozi include diarrhea, nausea, and vomiting. Dizziness and rash are also frequently experienced. Constipation and tiredness are other common side effects. Ibtrozi can cause serious side effects that require immediate medical attention. Your healthcare provider will monitor you closely for these. It is vital to know the signs and symptoms. Liver problems can occur and may be severe, even leading to death. Your doctor will perform blood tests to check your liver function regularly. This is done before starting, every 2 weeks for the first 2 months, then monthly. Watch for signs of liver problems. These include yellowing of skin or eyes, jaundice, loss of appetite, nausea, or vomiting. Dark urine, pain on the upper right side of your stomach, light-colored stools, or feeling tired/weak are also warning signs. Report any of these symptoms to your doctor right away. Lung problems, such as interstitial lung disease or pneumonitis, can happen. These can be severe, life-threatening, or fatal. Tell your doctor immediately if you develop new or worsening lung symptoms. Symptoms include trouble breathing, shortness of breath, cough, with or without mucus, or fever. Do not delay in reporting these symptoms. Prompt evaluation is necessary. Ibtrozi can affect the electrical activity of your heart, causing QT prolongation. This can lead to irregular heartbeats that may be life-threatening. Your doctor will perform tests to check your heart's electrical activity and electrolyte levels before and during treatment. Seek immediate medical help if you feel faint, lightheaded, or dizzy. Also, report if you feel your heart beating irregularly or fast. These could be symptoms of QT prolongation. Increased uric acid levels in the blood, known as hyperuricemia, can occur. This can lead to gout. Ibtrozi may increase your risk of bone fractures. Fractures can occur with or without a fall or injury. Tell your healthcare provider if you experience pain, changes in movement, or notice bone abnormalities. Ibtrozi may also cause fertility problems. This can affect both males and females. If fertility is a concern for you, discuss this with your healthcare provider before starting treatment. Your healthcare provider may need to adjust your dose of Ibtrozi. They might temporarily stop or completely stop your treatment. This depends on the severity of any side effects you experience. This is not a complete list of all possible side effects. Always consult your doctor for medical advice regarding side effects. You can also report side effects directly to the FDA. Certain things should be avoided or managed carefully while you are taking Ibtrozi. These precautions help ensure the medication works correctly and minimize risks. Always follow your doctor's advice. Limit your time in the sun during treatment. Ibtrozi can make your skin more sensitive to sunlight. This increases your risk of sunburn. When you are in the sun, wear protective clothing like a hat and clothes that cover your skin. Use sunscreen with a sun protective factor, SPF. Continue these precautions for at least 5 days after your last dose of Ibtrozi. Avoid eating grapefruit or drinking grapefruit juice. Also, avoid products that contain grapefruit. Grapefruit can increase the amount of Ibtrozi in your blood. It's important to take Ibtrozi consistently. However, sometimes a dose might be missed, or you might vomit after taking it. Know what to do in these situations. If you miss a dose of Ibtrozi, do not take an extra dose to make up for it. Simply take your next dose at your regularly scheduled time the next day. Do not double up on doses. If you vomit at any time after taking a dose of Ibtrozi, do not take another dose that day. Take your next dose at your regularly scheduled time the next day. Contact your healthcare provider if vomiting is a persistent problem. Proper storage of Ibtrozi is important to maintain its effectiveness. Store Ibtrozi capsules at room temperature. The recommended temperature range is between 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius. Keep Ibtrozi in a safe place, out of the reach of children. Medications can be harmful if taken accidentally by children. Follow the storage instructions provided by your pharmacist or healthcare provider. Ibtrozi capsules contain the active ingredient Taletrectinib adipate. The inactive ingredients help form the capsule and ensure stability. These include colloidal silicon dioxide, low substituted hydroxypropyl cellulose, mannitol, pre-gelatinized starch, and sodium stearyl fumarate.